Okay, next we're going to talk about neurological impairments. Let's look at our chapter objectives. We want to identify the categories of neurological impairments, describe the common neurological impairments and their symptoms, identify common medications prescribed for neurological impairments, including predominant contraindications or precautions, adverse reactions, and side effects. Identify the effects of neurological impairments on the oral condition. Assess the patient or the client's needs based on the data you collect. Develop an individualized treatment care plan, including implementation strategies for modifications based on assessment of patient-client needs. Develop individualized health-promoting goals and strategies for home care and maintenance. Present and explain the home care plan to the patient and the caregiver. What are neurological impairments? How do we define this? Well, they're disorders of the central nervous system, which includes the brain and spinal cord. It may include any loss or abnormality of psychological, physiological, or anatomical structure or function. The categories include the brain, problems in the brain or the spinal cord. In the brain, this can create sensory and motor disturbances, emotional disturbances, consciousness disorders, and episodic neurological disorders, and sleep and arousal disorders. If the spinal cord is affected, it may affect the station and gait, the way the person holds themselves and how they move. It may cause difficulty in the use of upper extremities, problems in respiration, urinary bladder function, anal rectal function, and sexual function. Symptoms are usually categorized more broadly. They can be physical or motor, cognitive or memory, affect or psychological, sensory, visual, or perceptual, or they can be a problem with communication. And this is a review of the sensory and motor nerves. Take a moment to review it. Okay, then we can have one of the common neurological impairments includes amyotrophic lateral sclerosis, also known as ALS, or Lou Gehrig disease. If you don't know who Lou Gehrig was, he was a famous pitcher a while ago, and he had this disease, and he played for the New York Yankees, I believe. It's a serious neuromuscular disease resulting in muscle weakness, disability, and eventually death. Symptoms are weakness in the legs, feet, and ankles, slurring of speech or trouble swallowing, muscle cramps and twitching in arms, shoulders, and tongue. Now remember, your dental hygiene considerations are going to include patient safety and comfort as the primary concern. As the disease progresses, it is probable that communication will be through the caregiver only. And the patient may need to be treated at home or in a different alternative care way. And the focus is on quality of life. How can you make this patient's quality better? So that you consider that under home care, and you need to give your directions or instructions to the caregiver. Another one of the common neurological impairments is Bell's palsy, also known as trigeminal neuralgia. This is unilateral inflammation that means it occurs on one side of the seventh cranial nerve. Results are weakness or paralysis of the facial muscles on the affected side. The symptoms are dysarthria, which is difficulty speaking, drinking, eating, or swallowing. They may be hyperacusis, which means they're much more sensitive to sound. Their facial muscles may be hypertonic or overactive, and they will have photophobia, where they have sensitivity to light. What do we want to do with these patients? Well, you want to realize that these patients are going to have a heightened sensitivity to facial paralysis. You may need to ask or communicate with the patient about symptoms and medications and what are their triggers for setting off one of these attacks. Consider treatment in closed operatory to avoid excess sound levels. You may need to use a saliva ejector or employ four-handed dental hygiene with these patients, and you want to recommend products to increase salivation and daily fluoride rinses to help with caries. Another one of the more common neurological impairments is cerebral palsy. This is a non-progressive, that means it doesn't continue to deteriorate, neuromuscular disorder caused by brain abnormalities or damage perhaps during birth. The types are spastic palsy, dyskinetic or athetoid palsy, ataxic palsy, and combined palsy. Your book does a pretty good job of describing these, so I'm going to leave that to you to review in your book. In your dental hygiene considerations, if the patient is not in a wheelchair, they may need assistance when walking. If they are in a wheelchair, if they have a special wheelchair that has a headrest and that tilts, you may actually treat them in the wheelchair. However, if they are in an ordinary wheelchair, you may need to transfer them to the treatment chair, and the patient may also benefit from just a calm, relaxed environment. A family member or caregiver should be present, advise daily fluoride rinses and products to restore moisture to the mouth. And this is a drawing showing you how the patient uses a transfer board to scoot from their wheelchair to the chair if needed. And you want someone holding that wheelchair in place and someone around the front to assist the patient should they have a problem. Another common neurological impairment is Huntington's disease or Huntington's chorea. It is a progressively degenerative inherited brain disorder, so it continues to deteriorate. It's also considered a familial disease passed from the parent to the child. And the symptoms include progressive physical, cognitive, and psychological deterioration. Chorea was this rapid, unintended movement. Other symptoms are dystonia, which is uncontrolled muscle movements and sort of a writhing of the muscles. The patient can have dysphagia, which is difficulty swallowing, or speech problems. And some of the things you need to consider is you may need to modify your care based on the severity or the progression of the disease. They may need to be cared for at home. Mouth props can be used to relieve tension in their jaw and muscles, and it's unlikely that the patient will be able to sit for long periods of time, so you want to use shorter appointments. You may want, for home care, to demonstrate the use of a power brush to the patient and the caregiver, and demonstrate the use of an irrigation device to the caregiver and or patient. Another common neurological impairment is a myasthenia gravis, which is the most common primary autoimmune disorder of neuromuscular transmission. It's characterized by asthenia or muscle weakness that is progressive. Symptoms include diplopia, double vision, ptosis, drooping of the eyelids, impairments to bulbar muscles, so they may have difficulty swallowing or with their throat and mouth muscles, dysphonia, which is characterized by difficulty swallowing and speaking. What do you want to think about with these patients? Well, you need to assess the patient's ability to communicate effectively. You may need to use a writing pad or an electronic keyboard. You want to schedule the appointments for the morning when the patient is fresher and keep them shorter and more frequent recalls or more frequent intervals of recall. These quick facial muscles prevent the patient from keeping their mouth open too long. You might try using a mouth prop. And for their home care, you need to optimize prevention. So what does this mean? Well, we want to use things that stimulate saliva, and we want to protect them with fluoride and good home care. You want to demonstrate the use of an oral irrigation device. Another fairly common neurological impairment, and we do have patients that we see in the hygiene clinic that have these things, is Parkinson's disease. This is a neurological impairment that is part of a larger group of motor system disorders. It's caused by decreased levels of dopamine produced in cells located in the basal ganglia region of the brain. And this results in tremors, slowness of movement or bradykinesia, akinesia, difficulty moving or weakness, postural instability, secondary symptoms, and symptoms specific to the oral cavity. There's an increased probability that other medical conditions exist, and exercise caution due to tremors. Use a mouth prop to assist the patient. You want to promote quality of life and prevention of dental disease. So what does that mean? You want them to be as comfortable and as clean as possible and put them on fluoride. And explain and demonstrate for the caregiver how to help the patient proceed. We also know from pharmacology, if you've had that already, that stroke is a disruption of blood supply to the brain. We have a clot or a brain bleed that leads to neurological impairments of the central nervous system. It can be can be ischemic, which is clot, and that means we have a cutting off of the blood flow to the region of the brain, or it can be hemorrhagic when we have a brain bleed. And this can happen in the right or left hemisphere and will have different effects depending on which hemisphere it hits. There's an increased probability that other medications or medical conditions exist. You want to exercise caution to tremors due to the tremors. Use a mouth prop to assist the patient, and you want to promote quality of life and prevention of dental disease. We want these patients to be as comfortable and as clean as we can get them to be. We want to use fluoride and prevent those caries, and you want to explain and demonstrate to the present caregiver, and they realize that this may change over time. So, to wrap it all up, you want to use critical thinking and be sensitive to these patients during the dental hygiene assessment. This is vital to developing adaptive methods of treatment delivery. Confidence in the dental hygienist education and skill development increases the comfort level of these patients interacting and communicating and treating. So take that all into consideration. Modified treatment modalities maximize patient safety, comfort, or response. You may not be able to treat them in the office. Another alternative treatment may be available for treatment facility, and you need to use an entire dose of preliminary assessment. That's where you pick up the phone and you consult with all the people involved so that you can have good treatment planning results in comprehensive total health outcomes. And here's our source once again. Thank you, and on to next